Welcome to the Auburn Medical Group YouTube live stream, the entertaining medical live stream where viewers can ask real-time questions of real medical doctors. And here are our hosts, Dr. Mark Vaughn and Dr. Gawain Vaughn.
Yes.
Yes, why is
it?
Yes.
It's not 4:30 yet when we started.
You're excited.
Because we had wonderful people in the chat who are already here.
They're already doing the
like Laura Webb and Lindsay Antoine.
beforehand.
Yeah, we're just having a conversation out there. So we will get to the conversation. We will get to the topic. Today's topic is, well, the title of the show is Once you start, you can't stop.
Like,
that could refer to a lot of things.
I was going to say, the first thing I think
Doritos?
of, I was totally going to think of
Doritos?
chips.
Is that
chips is what I was thinking of. Any type of chips.
Lays or Ruffles?
What's the Pringles? Once you pop, you can't stop. Is that the Pringles motto? I don't know.
Once you pop, that refers to something else.
Could be. I don't know.
If you know, please let us know. I was thinking of particular medicines.
Oh.
Because patients will have this impression. So this comes from and this happened a couple times. I'm trying to remember what medicine is. I've probably heard it both with blood pressure medication and with statin medication. This perception that, I'm a little hesitant to start that because my understanding is once I start, I can never get off of it or I can never stop. We will help.
Excellent.
We will help address that concern, which is not true about those medicines, but is about some, kind of. We will get into
Yep.
So that's what's coming up ahead on this.
Ooh, a preview.
Auburn Medical Group live stream.
Man, I'm hooked.
But first, we have the ninja chat.
First things first.
There you go.
Is he selling popcorn? So Lindsay, as you know, my son has ADHD, so he doesn't stay focused on the same thing for too long. So he's actually not doing that was through Scouts. He's not doing Scouts this year. So no, he's not selling any popcorn. Sorry.
That's not ADHD. Every kid bounces. So okay. So that's.
But we are normalizing neurodiversity.
Yeah.
Yes.
Well, yeah, because that's who we all work for. So Laura Webb says, "Good afternoon, doctors." And
good afternoon.
Z says, "Hi, doctors. Hi, Yahtzee.
Hey,
you're kind of a regular now, aren't
Excellent.
you?" Yeah, we're glad to see you up there. So we would like to get back to the topic of once you start, you can't. Oh, and none of you said what that comes from. It was like a potato chip commercial, or
I think so. It's got to be.
Okay. So, let's go over. I guess shall we say 3 broad categories of medicines? No, once you start, you can stop.
Sure.
And medicines that once you start, no, you can't stop.
Those are your 2 major categories. Yes, you can stop, or no, you should not.
I said 3 though, because
so what's the third category?
The middle one would be ones that, there may be side effects. So you want to taper.
Oh, okay.
You buy that?
Yeah, you're still stopping though.
Yeah.
True. Or you can stop and restart.
True. Yeah. Right. and we're kind of thinking in terms of medicines are used to treat something in particular. That's kind of a chronic thing that may not go away or resolve. You know, so people think of medicines that you would take to cure a particular thing. Whoa, what's all those hearts?
Like antibiotics.
What are those hearts?
I don't know. Somebody put some hearts.
What are those hearts?
Did I push hearts? Maybe that's what
Are you giving me hearts?
I love it.
Yeah. Okay. So, yeah, we should probably catch up because we have a new commenter. We have Lisa L. How are you both doing? How are you doing?
Good.
This is like one of the best parts of the week when we get to do our live stream with you.
It's a Monday.
Viewers,
I mean,
and Yahtzee. Well,
getting through a Monday. We're to the end of the Monday though. The beginning of the Mondays can be a little rough because we're coming to full inboxes.
Inboxes are full on Mondays.
We're good at avoiding work on the weekends.
Yeah.
Which is a good thing.
Which is a good family medicine sometimes will allow that. In our way of doing it, it allows for weekends off.
Focusing on family and other things on the weekends.
Yeah, and then Yahtzee is
Somebody's giving the hearts. Lisa's giving the hearts. There
Oh,
you
it's
go.
Lisa's giving the hearts. Oh, thank you, Lisa. That's cool. We can't see it here, but we see it when we
Everybody's
look.
giving the hearts.
You guys see it.
We
So
get hearts.
Yahtzee is saying binge eating for me. There is
Oh.
an ICD-10 for that. Yes,
Yes,
there
yes,
is
there
actually. ICD-10 being the classifications of disease, are codes that we use.
I guess that would
for
be.
things.
She's saying once you start, you can't stop. She's probably referring to.
Yeah, I'm sorry.
Eating.
You're
So.
taking in a different direction, but
Yes,
that's fine.
yes,
That's
yeah.
good. Because this is a collaboration.
Yeah.
And Yahtzee's also giving the hearts. So thank you. I'm not sure.
Yep.
I mean, it looks neat. They just keep going.
I just see hearts. It's
I
like
love
somebody's
it.
just
I
like.
don't- I'm sure there's some significance to it. It's probably good. And
Oh,
helps
we're
us.
getting pushed to the top of the list.
Yeah,
Everybody's
we're
going to
probably
be
showing up on everybody's
gonna
phones.
be
You need to
hopping
watch
on.
this live stream right now. All your friends. Okay, Laura Webb is saying, how about
Thyroid medication.
Oh, okay.
That's a great
All
one to
Thank
bring
you,
up.
Laura. Yes.
So-
okay, that's what we're looking for. We're looking for questions like that for things that we hadn't mentioned yet.
Yes.
So
yeah.
What
So
do we
you,
just-
you were talking about broad categories of treating, things that you cure versus treating stuff that you manage. Those are maybe our two major. So like a good example would be you get an infection, you need antibiotics, you take
Yeah,
them for
okay.
7 days, you're better. You don't need them
and it's
anymore.
cured. It's
Yeah.
gone. At least that infection was
Yes.
that bad. Until the next time you get it
Whereas
from whoever you gave it to. and give it
chronic
back.
diseases, high blood pressure, high cholesterol, thyroid, hypothyroidism often are long-term conditions that stick with you. So we
Sometimes
manage those.
Sometimes people
Yes.
with huge lifestyle changes or surgery.
Right. You can reverse some of those.
Those things you mentioned. Sometimes.
Sometimes we are
Yeah,
fighting
that's-
genetics and
Yeah.
some other things, some chronic disease states.
And I'm so sorry that we think of lifestyle changes fixing a problem not always first, because it's hard.
It is hard, and it takes time. So often
Yeah.
we need to get things under control acutely, or like right now, because things are out of control and we don't want.
Don't move.
What are you doing? What are you? Ow! What are you doing?
I pulled a hair out of your ear.
That's awkward.
Ow. It makes for good.
Okay.
It makes for good YouTube.
That was weird. Anyways, I totally lost my train of thought. I'm done.
I shaved.
You shaved your.
shaved my-
Am I getting to the age
my
where I
old
need
man-
to shave my ears?
Wild eyebrows.
Yeah.
I have a brother with wild earbrows. I'm
You-
not saying which one.
Did you say ear brows? Did you really?
They merge.
just straight,
They just goes right from here to all the way across.
straight in. It's a unibrow into earbrow,
Into-
straight into the beard. It's just facial hair. That's just what we.
Oh,
anyway.
that's my future. So get ready for it. Well, by then they'll have a filter built into YouTube to get.
They already have that, I'm sure, where you can do it the other way, where normal people can.
Tell me
look
how
like
to do a filter that makes it look like I have hair
unibrow.
or it hasn't turned
my
gray.
goodness.
Or,
Oh,
all right,
anyways.
so should we get to some comments and
I
questions?
lost
to
my
kind of
train of thought, so that's where we gotta
there
go.
We got to reset a little
Man.
bit because of me pulling it
Out of there.
your hair live on YouTube.
Good night.
That was painful.
That hurt. I did.
Oh, I'm so sorry. No, I'm not. I wouldn't have done it if I'm sorry.
Seriously.
I can still feel bad though. Can you feel bad about something you go ahead
Something
and do?
that you caused? I feel so bad that I punched you in the face and you broke your nose.
I'm not the one that nurtured the hair and grew it from a follicle.
You have the same genetics as me. I'm or at least some of them. I'm blaming it on you.
Okay.
At
Where
least,
did we
a
leave off?
quarter of my genetics is the
Oh,
same as you.
Okay, so we got Lisa telling. Wait, how did we jump to Lindsay? Well, Lindsay's great, but I was trying to hit somebody else. So, Lindsay, I've been told venlafaxine is one of the more difficult SNRIs to come. Okay, yeah, that's
great question.
So that was when I was thinking of the category of things that yes, you can get off, but maybe there could be a withdrawal. Some antidepressants are what I was thinking.
Yeah, absolutely.
I wasn't thinking specifically SNRIs. I was thinking some of the older SSRIs when I said that, but
Sure.
SNRIs, yeah.
Yeah,
also.
you often need to wean down on those so you don't get these side effects.
That's
It's not side effects.
that can be an issue.
Withdrawal effects.
And what I was trying to find was that Lisa one says, yeah, she takes
Levoxyl. Thyroid. Back to the thyroid. So yeah, often thyroid is one of those that you need to continue lifelong because your thyroid has essentially burnt out, or maybe you had a thyroid surgery, or there is a reason your thyroid is not producing enough thyroid for your body. So that is often a lifelong one. There are some disease states where it's short term, where it's just like a viral infection or things like that, but often you need to adjust it or change it around. You all right there? Don't stick up your nose.
Don't, yeah.
But thyroid medication is one of those more long-term medications that typically you cannot come off of. We do watch those levels pretty closely. If you're on thyroid medication, we check your thyroid levels yearly to make sure that they are appropriate and that medication is needed. So that's one of them that you need more long-term.
You did a good job there. Lindsay likes the idea of your brows.
Paxil.
Lisa thinks we're hilarious.
Somebody said Paxil. Paxil is one that can be hard to come off of too. Paxil, I'm not a fan of as far as the SSRIs go.
Edife Tucker O'Daniels brings up Gabapentin, one of our
Tucker O'Daniels.
Should I say one of our favorite medications to prescribe?
It's up there
for as
sure.
often as I go to it. It's like I have an affinity for. I get to prescribe Gabapentin.
For the most part, Gabapentin is very safe for the most part. I think I've only had one person with a bad reaction to it in all the years I've been prescribing.
I'm trying to think of all the medicines we prescribe commonly. Gabapentin is a very common one.
Yeah. And if you start low, at a very low dose, it's often well tolerated and a great medication for relief of nerve-related pain.
It is a really, really, really good medicine. Mm-hmm. Yes, there are some side effects for some people, but it's totally reversible. So it's like constipation.
Right, you stop it.
Some people have weight gain.
So the big side effect I had that somebody had was cognitive change. They actually kind of had some confusion.
But it reversed, right?
But they stopped it and it came back, yes.
Yeah.
So Gabapentin is one of those where if you get up to the higher doses, you do want to wean down. You can go up to 3,600 milligrams a day of Gabapentin.
Did we say that?
That is a lot.
Not everybody. Hold on.
You can. You don't need to.
We're not telling you.
I'm not saying that.
We're not telling you.
No, I'm not. I'm not saying
3,600 milligrams.
I'm saying sometimes we need to go up to higher doses to get the effect.
There are some patients of ours who we do take up to that.
I don't know how much you're taking Edife. Tucker O'Daniel. Tinafay. No, that's somebody else.
Edife.
Tucker O'Daniel.
I'm thinking of some kind of a
no idea what he's thinking.
Cajun food.
I think I know what you're talking about. Somebody will know. Anyways, if you're on high doses and want to come off of Gabapentin, it is a good idea to wean off of it.
They named a dish after her.
Is it called Edife?
I don't know.
We don't know. But Gabapentin. There you go. One you should probably wean off of.
What am I thinking of? Edife.
I think I know what you're thinking of, but I can't think of the name.
Edife. It'll come to me. Okay. Or if you know which Cajun dish I'm confusing with Edife Tucker O'Daniel's name, let me know. So Lindsay's, we asked the question about venlafaxine, and somebody asked about Paxil. Now that's what I was thinking of when I was thinking of SSRIs
that you need to wean off of.
An older one that has a reputation for needing to be weaned off.
For withdrawal effects, for sure.
Which gives a bad name to the other SSRIs, like the ones that aren't a problem.
Prozac, which Prozac is so long acting that you can just stop it and it'll just slowly wean out of your system. It's great. And Prozac is wonderful. Put it in the water.
It was the first one in the class, and we're still using it. Even with all of these new ones, we're still going.
Very good.
I actually don't use it.
It is Edife.
Etouffee. That, okay, it was very close.
Brute?
I'm sure she gets that all the time, so I'm sure she's used to forgiving people for...
I'm sorry. We apologize.
Yeah.
Et brute? That's something else.
I thought of that too. People are thinking that if they put their real name on this, we're just going to make fun of their name.
Oh, man, please. Yeah.
Who is that does that? That everybody calls in, they insult
every single name they're making fun of.
Yeah. I don't know. That's not us, is it? Okay, maybe it is. Sorry.
Well, it's not.
So, Prozac, yes, very good. But I do find myself using the newer, not the newest, newer one, Lexapro.
Lexapro.
I find myself going to Lexapro.
Great medication.
For SSRIs.
Side effects are a little less than Prozac. You sometimes need to wean off of
Pretty low dosing
Lexapro.
too, because
you can get quite the
you
effect.
start with 5 and then go to 10.
And at most go to 20. But
Yeah.
pretty rarely you need to get up that high to get an
So
effect.
I think we're both fans of Lexapro.
Oh yeah, for sure. It's usually my go-to.
Say that.
If it's just,
And kind of like Gabapentin,
straightforward
how often have you
depression.
had a bad thing happen? I guess, okay, so
Like I said, once in my
there's that risk for
lethargy, make you tired.
serotonin syndrome.
Yeah.
How many cases of serotonin syndrome have we been
We
exposed
all
to in our
seen
careers?
In all of our years.
Any?
None.
And we prescribe this medicine. How many of our patients either come in on it or we prescribe?
Yeah. Well,
And
Gabapentin
we've never
is
seen
probably
serotonin syndrome?
not the bigger risk. Probably tramadol with SSRIs is the bigger risk there. But anyways. What are we talking about?
Comments.
Oh yeah, once you start, you can't stop.
So yeah, Lisa takes Levoxyl. We got that.
Levoxyl, that's thyroid medication.
Had thyroid
name
problems
brand
since 13 years old, and it was hyper.
Hyper, now hypo. Yeah, so I don't
But-
know if they gave you medication or they did something to
Or surgery,
make,
or-
to ablate the
Sorry for the
thyroid to bring it down.
That's a lot.
So-
Bianca. Hi, Bianca. Gabapentin is awful. It didn't help me at all.
Oh, you're.
That can occasionally be the response.
Yes. Now you say awful. I don't know if that's because you had
Well,
side effects
I
or
was gonna
because
say,
it wasn't helpful.
usually-
That's the question.
Usually it's one or the other, not both. Either it was awful or it didn't work. It's the exception for it to be both. I'm sorry you had that experience with because, oh, what? Look. Leanne Vaughn.
Yeah, I know her.
I'm sorry, I'm kidding. Oh my goodness. I'm getting flushed. Okay, moving on.
Is she the one who pulls your hair?
I think she has. Yeah, I've felt it.
So you know,
All right.
it's like I tell my kids, what if I did that to you?
I know exactly what it feels like. That's why I feel bad while still I would do it.
But still doing it.
Yeah. There's things like that.
All right.
My husband takes 600 milligrams 2 times daily for peripheral neuropathy. Oh, for Gabapentin. Okay, so there's an example. Edife's given us an example of somebody who's on 1,200 milligrams total a day. Now, typically, we will prescribe
We dose it 3 times a day.
Yeah, we usually don't do just 2 times a day.
But I've seen people who just take it at night.
Yeah, and sometimes
or
people can
take
get
it-
by with less by spreading it out more. They
Yeah.
get less of a total daily dose. Like sometimes I'll have a patient who may come in taking what she's describing, the 600 twice a day, and be able to get away with, instead of 1,200 milligrams a day, get away with 900 milligrams a day
300.
by taking 300 3 times a day. Less side effects, maybe the same effectiveness.
Yeah.
So it's just things that
Right.
we do. Lindsay's saying, I can miss 2 consecutive doses before begin to feel strong. She must be talking about the
Thyroid?
SNRI.
SNR. Oh, okay.
Yeah.
Gotcha. Forget which one she was.
So
talking
yeah, that would probably be a long-acting one. Also, the I don't remember what she was. It was the venlafaxine.
I think so.
I think
Is that
so.
what she was talking about? We can go up.
So interesting.
Just said, yeah, venlafaxine was it.
Lisa had radioactive iodine for her.
Yeah, so
thyroid.
part of your
So
thyroid.
they irradiated part of your thyroid
irradiated
to kill
and
it off.
not working. So yes, you will need thyroid medication for the rest of your life. Because we doctors
Sorry.
took care of your hyperthyroidism by killing your thyroid.
This will fix it.
Be proud of us. There really aren't many other options. I mean, they could have surgically removed it, but yeah. It works. Radioactive iodine.
I was going to say something. I forgot what it was now. Yeah, I'm sure I'll come back if it was important, right?
Sure.
Okay. So, missed 2 consecutive doses, radioactive iodine. Z is talking about trazodone for sleep. Now, can you just stop the trazodone, or once you start it, you can never stop? Tell us, Dr. Gawain.
Yeah. So it.
Inquiring minds want to know.
Yeah, trazodone is an interesting medication. It originally was an antidepressant, kind of got rebranded after everybody they were giving it to was getting sleepy, so now it's mostly used for sleep. We use it at much lower doses for sleep than we do for depression, so like 50 to 100 milligrams versus 150 to 300 milligrams for depression. At those lower doses, you can often stop abruptly. However, you can have some insomnia as a kind of a result of stopping it abruptly. Truly, we do not like giving medications for sleep because they're just not great. They're pretty much all of them have risks. Trazodone even has risks. Its biggest risk is actually with your heart, arrhythmias. And then all the other Z drugs, as we call them, the Ambiens and those type have risk for dependency and definitely should not be
and
used
weird effects.
Yeah, like sleepwalking, sleep eating.
Intense sleepwalking.
Like doing things in your sleep that are weird.
Here's a story. Patient has this realistic dream, very vivid dream of going to the convenience store and getting ice cream. And then they wake up in the morning, and what do they find? They find an open container of ice cream that they got in the middle of the night.
Yeah.
In their kitchen.
Scary stuff.
And then other people talking about making a sandwich and the gas burner being left on with a paper towel right next to it.
Oh, jeez.
That was an Ambien story.
Yeah. So, the bad Ambien stories are bad. Like they are.
We
bad.
are not fans of those drugs.
No. Yeah.
We don't. I don't know if I have. There may be one patient that says, please give me my regular Ambien for when I fly to Florida. This sounds like a familiar thing here. Okay, we have Bianca just started on duloxetine,
which is one of those SNRIs.
I was going to say SNRIs are great for pain also.
Yes.
Chronic pain.
Yes, and they are approved for that. We were talking about gabapentin for nerve-related pain. Duloxetine has clearance to treat that as well.
Yeah, so somebody who's really hard to address their chronic pain, we're trying to avoid using opiates. We're either already using Tylenol and a non-steroidal anti-inflammatory drug, or we can't. And we'll use gabapentin if it's a nerve pain.
Yep.
And for any chronic pain, we'll use an SNRI.
Right.
Sometimes an SSRI for chronic pain. Yeah. Sometimes a tricyclic antidepressant.
Right.
For chronic pain.
Yeah.
Or nerve pain.
Nerve pain.
Yeah. Do you know that one? Sulfafinicin?
Yeah, that's for
Bianca's
urination, I believe. I'm trying to think of the other name for it.
Is that like Raider Nation?
Vesicare, I think is the other name.
Oh, is that Vesicare?
Yeah.
You can stop that. You can stop that.
Yeah. Anyways, we're just telling people to stop their medication.
Unless it causes
this
urinary
is not
retention.
Medical advice.
What if it causes urinary retention?
We're not. That's actually probably a risk of stopping those urinary medications.
Okay, so maybe we need to throw that in the class of medicine.
Yeah.
Once you start, you can't stop.
At least not abruptly. That's our caveat there.
Before we go on with the comments, which are awesome, so that's why I want to get to them. I do want to say there is a drug. Don't stop. There's a drug. Do not stop it once you start it, and that is Prolia. So a lot of people, there's a number of medicines that can be given through either an infusion or a subcutaneous injection once yearly or twice yearly for osteoporosis treatment to lower the risk of having an osteoporosis-related fracture. That's a great thing. A lot of people, for some reason, don't want to take oral or can't take oral bisphosphonates like Fosamax. Wait, Fosamax? Is that what I wanted to say?
Yeah.
Alendronate.
Mm-hmm.
And so they get on these injection medications instead. And I don't know why. Maybe it was just great marketing by whoever makes
Prolia. Yeah, they must
Prolia.
have done some good.
But somehow the Prolia, which is twice a year, not once a year, like some of the others,
Actonel.
Really got popular.
There's a name.
And
folic acid.
We just want the whole world to know, hold on, once you start Prolia, you can't stop that because your bones will get as bad as they would have been had you not started it really, really quickly.
Yeah.
Really quickly. We've seen the before and after x-rays, and I do not start people on Prolia. I will start them on some other medicines that the problem is if you stop it, you just don't continue to get the benefit of it. So you're where you would have been.
Which is the bisphosphonates.
Yeah, bisphosphonates. I prefer for that.
Yeah.
So Prolia, that is not something to start lightly because that is one of those once you start. No. But as far as the blood pressure medicines, the statins for cholesterol, no, you can stop it. It's just the problem will still be there.
If we didn't treat the underlying problem,
where it was
or you
before
have
treatment.
a strong, reason why you should have high blood pressure, high cholesterol, it will come right back when you stop the medication. But if some people, you can do some intense lifestyle changes and get that blood pressure down, or reverse some of that high cholesterol.
So if it's just going to come back, is there value to taking it?
Well, while you're taking the medication, it brings it down. So in the long run,
it's worth
we reduce your risk of
you get the benefit for the
heart
time you're on it.
disease, heart attack, stroke.
But you're not worse
CHF,
for having taken it.
No.
Yeah.
Biggest risk would be side effects, but we watch those closely and pick medications that have pretty minimal side effects. So try to reduce that. My bloods were so bad.
My bloods. We're so bad. Hemoglobin A1C, which
we don't report it in those numbers.
From 116.
I don't know what that means. Yeah, we don't report it in millimoles.
Millimole.
Because our A1C is reported in a percentage. So I don't know what that.
So wow, we ran into this. This is like that Saturday Night Live sketch with Nate Bargatze, where we'll have our own systems of weights and measures.
Temperature. You ask about temperature.
No, I didn't.
We'll measure thing in Fahrenheit.
And there will be rulers with both centimeters on one side and inches on the other. Oh, so you can see where they line up.
They won't line up.
They never do.
They never do. How many centimeters in an inch? Nobody knows.
Nobody knows.
No one will know. It's a great one. You should watch that.
Bianca, it's for pain in my back instead of my sertraline. I'm sorry, which one? Wait. So solifenacin is for pain in my back and instead of my sertraline? What do you think it is?
Solifenacin is Vesicare. So I do not know that being used for. I even looked it up. Solifenacin, Vesicare.
You stumped us with that one. Using solifenacin for back pain.
Yeah.
Okay. Lindsay, Cymbalta worked great for me for about a decade, and then my brain decided it needed vent. So she's talking about the poop out syndrome.
Oh.
Now I'm familiar with it with SSRIs and how to manage it.
I don't know if I've ever heard it called that, but go on.
Oh, okay. I thought we've talked about this. So poop out syndrome is where I know it from SSRIs, where you'll be on an SSRI and it just doesn't work anymore. So you switch to another one and you get the benefit again.
Yeah.
And here's the thing: eventually, if you need to, you can switch back to the original
because your brain's
if it worked better for some reason, or if you had poop out syndrome again, and it works again. So. Some people talk about medicines stop working or your body getting immune to them. It's not actually an immunity, but things not working as well. I have heard of that. It's my understanding that can happen with SSRIs. I may be, falling for some kind of a urban legend or myth on that one, but
seems to happen. Yeah, at least
that
by
is my
experience.
understanding. How about other medicines that your body adapts to it, and so they don't want to start it because of that? Now that'd be true of opiates.
Right. The
body changes as you take it.
It does build up a tolerance, and that's a true tolerance where you need a higher dose to get the same effect.
People think that of Tylenol and NSAIDs. Is that true?
Yeah, no, that's not true. You cannot build up a tolerance to Tylenol. That's not.
How about antibiotics?
So it's different with antibiotics because you're not building up a tolerance. You can get resistance where that bacteria...
Somebody is getting immune, but it's not you.
Yeah, that bacteria has created a mechanism by which it can bypass or defeat or somehow get around that antibiotic's action.
So the little bacteria, their lifespans are so short that lots of genetic changes accumulate quickly. And there's going to be some that may, by just mutation,
by chance, we're talking truly survival of the fittest here.
Have a resistance to that drug, and
that's the one that's going to be proliferating.
That's right. So you
kill off all the other,
wipe out all the others, and that's all you got is the resistant one. After.
And that's why we are,
because it replicates,
very judicious with our antibiotic usage, because we see multi-drug resistant organisms where we've got to, we can't treat a UTI with pills. We've got to go to IV antibiotics.
We're starting to see it.
Yeah, or things that we got to get into these very obscure antibiotics to treat.
So that's why we don't give antibiotics for upper respiratory infections, because they go away without antibiotics.
Yes, yeah, and all we're doing is creating resistance there. Yeah. And if you are prescribed an antibiotic, you should complete it. Don't. Once you start, can you stop? Yes, once you've completed the whole course.
Because it does make us at higher risk for the resistant
Yes,
organism.
yeah, you do not want to stop it early.
That kind of behavior. Where did we leave off here? That's a new person commenting.
Who's that?
It is Georgette Locke. And Georgette Locke says, never start Xanax. Been on 9 years, can't kick it. That
was prescribed.
When's the last time we started somebody on Xanax in our office?
I'm trying to think if I ever have in the 11 years that I've been here.
So we're very unpopular with people that can't find a solution for their problem other than a benzodiazepine like Xanax, because we don't prescribe them.
Right. They like you say, Georgette, are very, like 9 years, you can't kick it. They are very addictive. And the tough thing is that is a type of addiction where you cannot stop it abruptly because it puts you at risk for seizures. So you've got to wean off of that. And it is a long weaning process that typically takes months, sometimes years, depending on weaning. I did say weaning, yes. Sometimes years to completely get off of the medication.
I love this show.
So yeah, it can be done, but you need very close supervision by a doctor and somebody willing to walk you through with it.
Okay, Bianca's educating us on units here, because it says 116 is 12.5.
That is a high A1C. But she said she got it down to 50.
165?
116. I don't know that.
Is she talking about a single reading? And that wouldn't correlate to hemoglobin.
Maybe, yeah, and an average 116 is not millimoles, that's milligrams per deciliter.
Who is the third doctor in the middle? Oh, no, Patty's not a doctor.
Yeah, look at the hat.
Solnefacin is for my overactive bladder.
See, we were right.
Is instead of sertraline.
Ah, there we go. That makes sense.
All right.
That makes sense.
Bianca, my blood's at the highest. It was 24.7. I was so ill. Again,
yeah, we don't know the units here.
We're used to different units.
We're a little confused.
All caps, benzos.
Oh, benzos.
Oh, benzos. Yahtzee, I believe medicine is an art. Many doctors try off-label treatments but do no harm, correct? You go off-label.
It puts you at risk, for sure. We're just talking about like legal risk, truly, if you're using something off-label. There are, like, we don't just randomly prescribe stuff. Well, we practice what's called evidence-based medicine. So
I was just thinking something the other day where you just. So if it's written up, if there's some data to support it, but it just hasn't gotten the FDA indication.
Sure.
And there's some good articles out there. For example, Up to Date.
Yeah, sometimes it makes recommendations.
Make recommendations that are off-label. And so if you find it somewhere like that, I've got a degree of comfort with doing it.
Sure, I agree with that.
I mean,
you've got some coverage if you're sued, if that's the case.
You got something to refer to. Say,
hey, this is why I did this.
There's enough data for it to get in there. So
yeah.
But yeah, there's
just randomly prescribing something.
Yeah, we'll have patients come in and ask for a medicine, and what are your symptoms? Totally off-label, and
we don't treat that with that. That's not an appropriate.
I'm thinking of one in particular where the patient's specialist told her to get it from us because it was a newer medicine. It was probably like a GLP-1 agonist or something like that. And I think the patient didn't quite meet criteria for a diagnosis, but maybe it was close.
Yep.
And the specialist would say, well, go get it through your primary doctor. And it was for something wasn't indicated for.
It's very easy to say that as a specialist, but yeah,
so
kind of
you're
throw
the
that on us.
specialist treating this, and you throw it on the primary care doctor.
Yeah, that's not cool.
Yeah, so what's going on there? Oh yeah, the primary care doctor can get in trouble for prescribing something what's in my field indicated. That I won't do it. So no, we left that to the specialist.
No, in that
kind of
case.
like today when I said, the specialist can order those labs.
Yeah, they've got a doctor's license. They should be able to order their own labs.
They're licensed to order labs. So yeah, I didn't do it. I'll leave it to the specialist.
Yes, we don't like other doctors telling us how to practice medicine.
Well, okay. So the specialists get paid more than we do for everything. For the exact same code, they get paid more than we do.
He's on his soapbox now.
And then they say, have your primary care doctor order blah, blah, blah. No, because then I'm responsible for the abnormal results.
Oh, yeah, I remember the example you were given today.
Yeah. So, no. And
especially something that we don't
Let's keep
order
track of who
often.
the specialist is and stop ever sending referrals to them, too.
Oof. Yes, we are. That's us.
Primary care, power of the referral. Okay. Yahtzee. Many patients try to sway doctors into giving them an antibiotic for UR. And they get it from a lot of doctors, too.
Right.
I'm surprised at how much of that I see going on in urgent cares.
Yeah, it happens a lot.
Yeah, concerning. So, yeah, we're not going to go over that today. Lindsay, we love you, Bianca, but we're not going over that today. Lindsay, 1 milligram lorazepam is a lifesaver if your panic attack is not responding to any lorazepam or probably the Xanax too.
Yeah.
Not that I'm going to prescribe it for that. But
rarely,
it works for it.
if they can be given in.
That's why it's used.
If you're having that twice a year panic attack, then.
That's exactly what she's.
Hey, there you go.
2 to 3 a year. And then Yahtzee, always rift between specialists and primary care.
Oh, not always. We have a lot of specialists that we really enjoy
love.
and that we work with very
There are
closely.
specialists we love.
Yeah, that get all of our referrals in that specialty.
Should I just name specific doctors that I have a problem with?
Here's our list.
So the specialists we love?
We love a lot of our specialists, and we have a lot of great specialists we work with. Usually,
goodness, we have
people who
great
do this are
specialists.
not ones that we work with closely. They're random.
Yeah, we love the specialists we use, and the ones we don't use, there's a reason we don't use them.
Yeah.
Unfortunately, the reason had a name.
Sometimes is this somebody I would send my parent to?
The longer I'm practicing medicine here and my family's here, the more it's somebody I sent my family member to.
Yeah, exactly. Yeah.
So I actually, instead of the line, it's who I'd send my own mother to. A lot of time, it's the guy who operated on my mother-in-law, or it's the guy I had my wife schedule with, or
Yep. I have that.
Yep.
With my
It's
family.
happening. Okay, we've got a question from a name I don't recognize, Patricia Kramer. Thank you for watching. Thank you for commenting and participating in the show. How to wean off sertraline? Well,
Slowly.
of course, it's going to be between you and your prescriber.
There you go.
But
Depends on the dose. Depends on how long you've been on it.
But typically-
that's what I would say.
when I'm doing these medicines, I will half the dose every 3 or 4 weeks. That's a typical, just to throw something out of how I do it.
Sure. I do it a little more quickly than that, but yeah.
Okay, fair enough.
Yeah,
I
but
pulled
again,
that hair out of your ear, so you can say
yeah,
anything.
I will disagree with you straight up.
See another one.
It depends on how long you've been on it. Don't touch my ear.
See another
I'm just going to walk off the
Another
set.
earbrow.
That's how we're ending this if that happens.
It made for good YouTube. Man. It really is.
It'd be even better. We just
Console yourself in your Dutch. Okay, Bianca, my doctor had me take less over a few days and then change to the new.
When you're transitioning to a different medication, often you can make that transition where you go from one to another because they work similarly and they're both affecting those serotonin numbers or serotonin values in your head. So you can get down to a low dose and then switch over to a low dose of the other medication and then start to go back up. So yeah, we do that sometimes, or sometimes we even overlap them a little bit.
When like SSRIs, SNRIs, I'll go ahead and just what's the equivalent roughly? What's the smallest that comes in? What's the largest?
Yep.
What's the range on this one? Okay, so what's the equivalent dose to what they're currently taking? I'll just do straight over for that.
Sometimes.
And they may have withdrawal for a couple of weeks, but
Yep.
But they get to try the new type of medicine and see. Bianca did over a weekend from 150 to 30 milligrams of duloxetine. And Patricia Kramer is saying 100
3
milligrams.
years, yeah. If you've been on it 3 years, you
3
probably want to do a slow wean.
Yep.
Slow taper.
Yeah, more like mine than like Quane's
Closer to yours,
recommendation.
probably.
That's-
All right.
Okay, thank you.
There you
Dr.
go.
Gwaine. And know that Dr. Gwaine sacrificed pain
Yeah.
for your entertainment. Slapstick here. Yeah.
Jeez.
Still hurting, huh?
No.
You need some ice for that?
No.
Need to see a specialist. Do you need me to refer you to a specialist?
Like an ENT.
One I would send my own nephew to.
Your niece, at least. She's seen an ENT. My wife. Anyways.
Oh, I didn't know she saw you. Oh, that's right. We made a video
There's
of
a
it.
video about it, so it's not like it's a
We
secret.
made a video of it. It's right there on the channel.
yeah.
That was the...
Oh, wait, that was a long time ago.
did he do a myringotomy?
Yeah.
Yeah, okay.
Anyways.
And she went vagal.
Yep. Made for good YouTube.
I shouldn't laugh. It did make for good YouTube. Okay, thank you. Oh, Bianca. Sertraline stops all feeling. I just felt numb. Duloxetine is
yeah,
a
you don't
lot
want
better.
that.
Oh, interesting. And Yahtzee's bringing up Fior. Oh, gee. Fior. Do you even know that one?
No, I know it. Yeah.
Really?
Yeah.
It's still around?
I think it is. Yeah.
Okay, so I think of Fioricet being something from like way back.
Well, it is because it's just not used anymore.
I haven't seen it.
Yeah, it's just not. Yeah.
Thankfully,
how do
we got away from that
we
one.
treat your migraine? We knock you out. You'll wake up after it's over.
It'll be gone, hopefully. Okay, thank you for that. That was a show. Wow, that was a show. Thank you, viewers, for participating, and for the hearts. That was kind of cool. Whatever that was. And
Yeah, I
of course, we
needed
always
those
mention Lindsay because
here.
she. Why do we mention Lindsay?
Hearts.
Because of the Patreon. That's why we mention Lindsay.
Wow,
Patreon.
look at that.
Where there. And also that Dr. Von name, the way it's spelled out there with no space, that's how you find me on the streaming music platforms.
Sweet.
Working on a second song.
I saw that.
It's very medical.
Okay.
So until next time,
Hey, I'm Dr. Wayne Baugh.
with one less hair in his ear. And Dr. Mark Vaughn telling you
Jeez.
to stay in good health.
Doctors, thank you for another informative session. Auburn Medical Group is located in Auburn, California, USA. Thank you for participating. Please tell a friend and join us again next week.